The EU really needs this awareness week because alcohol and the use of alcohol, or I should say misuse of alcohol, is one of the most big burdens, enormous burdens on the health services in Europe. It costs us in the region of €1.55 billion a year to deal with the health problems that are created by alcohol. That's before we even start to talk about the sociological problems, the levels of unemployment that are caused by alcohol, and of course the levels of disease. It's one of the largest causes of non-communicable diseases in Europe. It's an underlying factor, it's one of the 4 key underlying factors for things like cardiovascular disease, stroke, cancer, liver disease. So tackling alcohol dependence and misuse is a really high priority, I think. The European Month of the Brain in May 2013 is a really important month for us in terms of health research. We've recognised that neurological and brain diseases and disorders are among the biggest challenges for Europe in terms of our health systems. And of course within that, alcohol dependence is a really important area that definitely warrants further and more in-depth research. To date we have spent €1.9 billion during the course of frameworks programs 6 and 7 on brain research, and within that we've invested a lot of money in looking at both the sociological impacts of alcohol related diseases, but also the economic impacts, and of course the biomedical ways that we can tackle the problems caused by alcohol dependence and misuse. There are some really important gaps, and as we increase our research initiatives in this area, we discover where those gaps lie. And I think this is a generic issue in some ways for a lot of the health research we do, is that we need to join up our biomedical research, which is very much hard science, trying to find the right drugs, the right vaccines and so on. We need to join that up with sociological research, with economic research, with behavioural research. So, for example, there's a lot of stigma around brain-related diseases, and that includes alcohol-related diseases and disorders. People don't want to go to the doctor because they're ashamed that, they feel maybe they've caused this problem themselves. There's a societal stigma attached. I think that we can do a lot in terms of research and education to improve the status of those people so that they feel that they can go and seek help at an early stage and head off at the gap an awful lot of the problems that they will face further down the line if they don't address them early on.